Good morning, Eben.
Just give us the broad strokes. What came out of this Provincial AIDS Council meeting?
Eben, what came out of the meeting was really encouraging on a province heavily burdened with HIV and AIDS as well as TB. What came out is that the women that are pregnant and are booking early now in antenatal clinics, which means, or this has led to the reduction of mother-to-child transmission, as well as everything is stabilizing. More people are on ARVs now, about 800,000 people are on treatment, as well as new infections are stabilizing, as well as deaths. And this is what came out of the meeting, but also now they were disturbing, reports, as we know that now there are people who are claiming to be having a cure for HIV and AIDS, case in point, Bishop Nala.
Yeah.
And this was discussed at the council. But they decided that they will be meeting with these people, including the bishop, who is using holy water, and try and get volunteers that are HIV positive, that are on treatment, to take the holy water and see, and after that, and if they test them and see if they will be negative as they claim to be. That was also discussed, and that was like what came out of the.
I want to talk about the faith.
Meeting.
I want to talk about the faith water and Dr. H.Q. Nala in specific. We had him on the show last week, and he told us that no, people have to have faith, then the water works. So now the provincial department, they're going to take this water and test it. Isn't that a little bit crazy?
No, they're not going to test the water, Eben. They are going to engage the bishop. They want him to come on board. They want him to agree that then he will bring the water, and they will provide volunteers, people who are HIV positive, who are on treatment, and they will carry on taking treatment whilst they taking the holy water. After some time, then they will be tested and see if they are positive or they are negative.
I await those trials as well then, Linda. I think the entire country would love to see if the bishop's water has anything specific. He told us last week, Linda, that the water comes from some company and he blesses it and then it works. But let's move on to KwaZulu-Natal itself. It used to be the province with one of the highest numbers of HIV infections. What did they say at the conference? Is the state of affairs improving in the province?
Yes, even as I said, things AIDS in the world and TB, South Africa leads, and when you zoom down way about in South Africa, where we have the heaviest burden, that is KwaZulu-Natal, and things are stabilizing. As I said earlier on, more people are taking ARVs. Not many people are dying from the disease, not unless, of course, they're defaulting, and my mother-to-child transmission has reduced, and then about 3 years ago we were sitting at 20, and now we are sitting between 1 and 2, which is a good encouragement. But they have got plans in place, and they've got what they call war rooms, where communities and government officials meet and strategize on how to fight these diseases, and see how service delivery can be implemented. And from those war rooms, strategies are coming out, and people are talking more about the disease, people who are infected. So we are also seeing, the problem of stigma being reduced as well, which is a good thing, because now people can openly go out and test, and when they find that they are positive, they just take the treatment, which now we know that you administer it, and HIV will be like any other ailment, your sugar, diabetes, or high blood pressure.
Thank you very much for your contribution this morning, Linda. That's Linda Mgobozi coming to us live from our newsroom studio in Durban.